Welcome to the grand finale of pregnancy, the third trimester. This is the stage where excitement is at its peak because you're very close to meeting your baby. From feeling those powerful kicks to these final spurts of growth, the last leg of this incredible journey brings both challenges and joy. Buckle up for a remarkable adventure of preparation, transformation, and a boundless wonder. Hi, I'm Dr. Shubhiaggarwal and welcome to the fourth episode of Blossoming Bellies, your guide to a healthy pregnancy. The link of this playlist is given in the description box below and it will tell you about every little detail in pregnancy. What to expect, what not to expect, what are the changes that you see in your body both physically and emotionally. How can you prepare for a pregnancy? How can you prepare yourself for labor, for delivery? What should be the mode of your delivery? Third trimester is described as the most challenging phase. It is the most transformative phase both physically as well as emotionally for the expectant mothers. During the third trimester, a woman's body undergoes significant changes. One of the most noticeable changes is the baby bump, which increases to its fullest size. The baby weight increases exponentially at this stage. This expansion may lead to backaches, increased pelvic pressure, and there may be a difficulty in finding a comfortable sleeping position. Along with this, many women experience swelling in their feet and ankle due to increased fluid retention in the body. You may also feel breathless during this time as the expanded uterus pushes against the diaphragm. Furthermore, there is a feeling of urination very frequently. The growing uterus pushes against the urinary bladder and causes the urge of fullness. Also, it makes it hard to empty the bladder completely, which may lead to urinary tract infections. Do not leave this UTI untreated, otherwise it may lead to serious complications. There may also be a little leakage of the urine, which is absolutely normal. This is because of weak pelvic floor muscles. Hormonal imbalance can weaken your pelvic floor muscles and you may not be able to hold the urine properly. In addition to these physical changes, there are some changes in which your body prepares for labor. How? So there are contractions called as practice contractions, which are named as Braxton-Hicks contractions. These are irregular contractions. These are painless contractions that help you gear up for labor. As I mentioned in the previous video that you start to feel your baby's movement at around 5th month in the pregnancy. But now at this stage in the third trimester, you may be able to feel every little movement of your baby. But when to know if that movement is okay, if that movement is less, or if that movement is more? For that, we have to count daily fetal movements. That is called as DFMC or daily fetal movement count. How to do that? So there are technically two ways. The first way is after every meal you have to lie down for 1 hour and you have to count your baby's movements. There should be at least 3 movements in 1 hour. So you have to do this after your breakfast, after lunch and after dinner. But in any case, if your daily routine does not let you lie down for 1 hour 3 times in a day, then what you can do is you can count the movement from the morning to the evening. So in one day there should be at least 10 movements. You can make a diary, you can write with a pen, you can even tear up paper. So you have to count the daily fetal movement count. Now when should you visit your doctor? Number 1, if you think your baby is moving less. Number 2, if you think your baby is moving excessively. Number 3, if you're finding any changes in the pattern of movement, like yesterday till now your baby was moving a certain way, but now you feel that a change is quite significant in the movement, then you should definitely visit your doctor. Your doctor will perform a non-stress test in which there's a machine which is connected to your belly. It counts your fetal movements along with some other parameters to check whether everything is okay or not. Additionally, there may be increase in the breast size, and some women may also feel discharge from their nipples. So this is colostrum. Colostrum is the first milk that is produced by the mother. So at this stage, what you have to do, you have to just wipe the colostrum off. Do not squeeze it. Remember not to squeeze it, just wipe off. It is absolutely normal. It is because the influence of hormones. Your nipples may also become sensitive and your breasts may also become quite sore. By this method, the body prepares itself for breastfeeding. Furthermore, you may also experience varicose veins or swollen feet. Why does this happen? Because the growing uterus, it stops the blood from going from the veins of the lower limbs, from the veins of your feet to the heart, which leads to the accumulation of blood in the superficial vessels, and the superficial vessels, they become swollen and they become purplish in color, which may look like varicose veins. Emotionally, the third trimester is a whirlwind. The expectant mothers, they feel a mix of excitement and impatience as the due date approaches. There's a palpable anticipation to finally meet your baby, coupled with the instinctual drive, commonly called as nesting. Nesting is something by which emotionally you prepare everything for your baby, from maybe your hospital bag to decorating your baby's room to setting up a nursery or anything, any preparation. This can involve any little preparation, and you may want that every little detail is perfect for your baby's arrival. However, along with these positive feelings, it is also natural to have negative feelings as well. You may have a mix of questions. Will I be able to handle labor? Will I be able to handle a baby? Am I strong enough to raise a baby? Am I ready to be a parent? Will my baby be healthy? These are just a few questions that might weigh heavily on the mother's mind. It is very important to acknowledge these fears and anxiety. Talking to a healthcare provider, attending childbirth classes, talking to your partner, your supportive family and friends can be incredibly helpful. Remember, these fears and anxiety are a natural process of this journey. Seeking information and reassurance can help you become more confident for preparing for a baby's arrival. At the very end, if you feel watery discharge, or you may feel leaking, any vaginal discharge mixed with blood, or any colored discharge, you may definitely go to your doctor. You might be into labor or you may go into labor very soon. In conclusion, the third trimester is challenging both emotionally and physically. It is a period marked by significant growth, anticipation, and understandably a fair share of anxiety. By embracing these changes, recognizing the feelings, and addressing the fears can help expectant mothers navigate this final stage with strength and grace. I hope you found this video helpful. If you have any further questions, you may ask in the comments below. And in the next video, we'll talk about the mode of delivery, how to plan for your delivery, whether it should be an abdominal cesarean section or it should be a vaginal delivery. If you like this video, give it a thumbs up and share with your family and friends. Thank you.